Stewart. MUSC Columbia is working to expand your healthcare options here in the Midlands. Joining us to talk about a new department in town is Dr. Matthew Simmons, a urologist with MUSC Columbia. Thanks for being here.
Thanks for having me.
So tell us what a urologist does for those who aren't familiar.
Urologists are surgeons. We take care of things relating to the genitourinary system.
What are some of the illnesses that you treat?
Well, there are a lot of different ones. Enlarged prostate, kidney stones, bladder infections, cancers of the kidney, the bladder, a large number of things.
So as you can imagine, I mean, those are really important issues that you're helping people with. Are there any maybe benign issues that you also help with?
Oh yeah, well certainly I would say most of our visits are for benign conditions, kidney stones certainly being one of the more common things we see.
What symptoms are patients usually coming in with? Is there any typical symptom?
Some people may find it that their urination is different, that they're having burning or blood in their urine possibly, sometimes pain in their side, things of that nature which can suggest something's wrong.
Is there any specific age that you typically see patients coming in, or is it all ages?
It is all ages, yes, for certain, although people seem to associate urology with older men, but that's not necessarily the case.
About how many people in the U.S. will eventually need to see a urologist at some point?
About a third of the U.S. population will eventually need a urologist at some point.
Now, does someone need to have a referral from their primary care to come see you?
No, they don't if they have a urologic problem or they think that it's urologic. We're of course happy to see them. Typically, most patients are referred from their primary doctor or from the emergency room.
Now, this is a new department with MUSC. Tell me a little bit about your background and how you got here.
Yeah, so for the past 4 years, I've been a professor at Medical College of Georgia. Decided to move here because it was an opportunity to start a new department, which is very exciting. Just started about a month and a half ago, and moving forward over the next 1 to 2 years, we hope to recruit 4 to 5 other urologists and become a presence in the city.
Yeah, and that's exactly what I was going to ask, kind of your vision for this department.
Yeah, well, MUSC in Charleston, of course, is kind of the mothership. We certainly hope to be an equal partner in that arena, providing advanced urologic care for people in the sort of central part of the state.
Why should someone choose to come see you in your new department if they're experiencing any of the symptoms we talked about?
Well, I mean, we provide state-of-the-art care. MUSC has made a large investment to start the department here. We do everything from general urology all the way to complex robotic surgery for urologic conditions. The caliber of the urologists that we are hiring is superb, world class. So certainly MUSC will have that to provide.
Is there anything else that you wish people would know about your department or about urology overall?
You know, I would say that urology, once again, it's not just older men. It's kind of a preconception that a lot of people have. We see equal numbers of women and men for a number of different conditions. If you think you have a urologic issue, talk to your primary doctor. But if you do have an issue, you're most welcome to come see us. We'd love to take care of you.
Wonderful. Thanks so much for being here.
Thank you.